Back now on Triad today, and we're going to tackle a kind of a tough topic, but we need to know about it. We're talking about safe sex education. How important is it? We're going to turn to an expert, and J. Paul, our director, if we can meet a very special guest, first-time visitor to Triad today, Dr. Natasha Dwamena. She's with Pinewest OBGYN, has 2 locations in the High Point area, and my hands are cold today. I'll give you a handshake. How you doing?
I'm fine. How are you?
From New Jersey.
Yes.
And you went to Stanford.
Yes.
And I've always wondered, before we get into the topic, I've always wanted to know, what does the cardinal mean? Are they talking about a bird or what? The Stanford?
The tree. The tree, the cardinal tree.
It's the cardinal tree. All right. You heard that right here on Triad today. All right, let's talk seriously now. Regardless of what you, as a woman, you as a person, think about when a young woman should have sex, we're not going to get into the moral aspect of this, but as a physician, how important is it for young women to have accurate information about STDs, reproduction, that kind of thing?
It's very important because younger women, over 50% of the new cases of STDs are in teens, young women, ages 15 to 24. So that's over 50% of the new cases. And there's a lot of misinformation towards young women about what they should be doing and what they can use. And the more information that they have, the more understanding of what their options are, they can make more informed decisions about what they can do.
What are some of the specifics that you focus on when you share information with your patients, especially younger patients?
Well, primarily I focus on pregnancy prevention. There's many different ways to prevent pregnancy, starting with the birth control pill, and then other options from the vaginal ring and longer term, like the IUD or the implant-on.
Right.
I also talk about reducing risk of STDs. Part of the benefit of condoms, perhaps, is also to prevent STDs as well.
Right.
And so once they know what their options are, then they can decide what's going to be reliable for them.
And I don't mean this as a joke or anything, but when you talk about misinformation, a lot of young women, don't they seem to think that they'll come in and say, well, doc, I'm okay, you don't need to talk to me, I'm on birth control pills, so I can't get any kind of a communicable disease. Do they often say that because they think that somehow that's protecting them, but it's not?
Yeah, they often think that, and then they also think because they don't have symptoms or their partner doesn't have symptoms that there isn't any cause for concern. But there's a lot of common STDs that don't have symptoms. For instance, chlamydia, herpes, HIV, none of these things have symptoms.
What concerns you most, if you had to, maybe there's a lot of things, but let's narrow it down. It concerns you most about young women engaging in risky sexual behavior?
It's concerning that too many young women don't even feel comfortable even addressing the topic of their partner's or potential partner's sexual history, if they've ever been tested, or if they're not ready for sex, to actually say that they're not ready for that.
Right.
Too many women don't feel comfortable actually bringing that up, which they should.
And I think people of all ages, that's sort of typical, isn't it? Especially down south, we just don't like to talk about things like that, right? Mm-hmm. That's kind of a barrier to good information, would you say?
It is. And, again, finding a provider that you feel comfortable with, who's comfortable talking to you about it, but also, giving you the information. If they don't have it, at least directing you to the proper references and resources. All right.
Now, is there any preventative measures that young women should consider before engaging in sexual activities? Very quickly, what do you think?
The main thing would be the Gardasil vaccine. This is a vaccine that's given to girls primarily between ages 9 and 26. For 4 types of HPV that's been related to not only cervical and vaginal cancer, but as well as genital warts. Okay.
Let me put up this information on screen, www.cornerstonehealth.com. You can get lots and lots of information on this and many other topics, and also get in touch with Dr. Dwamena, who has her 2 offices in High Point. Very quickly, before time runs out, why did you want to become a doctor? I'm always curious when I meet somebody for the first time.
Well, beyond helping people and educating people, I always wanted to do something where I could help people live a better life, and take better care of themselves.
You're doing that, and that's admirable. Thanks so much, and thanks for explaining what the Stanford Cardinal is to me.
Yes.
I felt so ignorant.
No problem.
So you've educated me on
Yes.
that. Thanks, Doc. We'll be right back after this.